Welcome to The Explainer. Today, we're going to get into the weeds on something super important for managing diabetes, your insulin sensitivity factor, or ISF. I know, it sounds a little technical, but trust me, understanding this is one of the most powerful things you can do to personalize your diabetes care.
So let's just jump right in with the big question, the one that really gets to the heart of all this. How much does one single unit of insulin actually lower your blood sugar? The thing is, there is no single answer. It's different for everybody. And finding your answer, well, that's what this is all about.
The answer to that question is really all about your own personal correction power. So let's start there and figure out exactly what that means for you.
Okay, so the official term for this is the insulin sensitivity factor, or ISF. And all it is really is a number that tells you how powerful one unit of insulin is in your body. Think of it as your unique superpower for correcting high blood sugars. It's the key to making those really precise adjustments. Now, this is super important. We are only talking about your rapid-acting insulin here, the kind you take for meals or to bring down a high. Your long-acting or basal insulin, that's your background insulin, and it's a completely different ballgame with its own set of rules. So for today, just focus on that fast-acting insulin.
All right, so how do we figure this number out? Let's get into a really common and practical way to get a starting point. It's called the 100 rule. It's really just a simple two-step process to get a great first estimate. First, we need to figure out how much insulin you use in a day, and then we apply the rule. Simple as that.
So step one is finding your total daily dose, or TDD. Don't let the acronym intimidate you. It's literally just the total amount of insulin, both your long-acting and all your rapid-acting doses for meals and corrections that you take in a typical 24-hour period. You just add it all up.
You know, the best way to get this is to see an example. So here we go. We've got the background basal insulin, the doses for breakfast, lunch, and dinner, plus any extra correction doses. We add all that up, and for this person, the total daily dose is 60 units. Let's hang on to that number, 60. Okay, now for step two. And for this, we need a bit of a magic number, 100. This is the constant we use for the calculation when we're measuring blood sugar in millimoles per liter, or mmol per liter. And the formula itself, it honestly could not be easier. You just take that magic number, 100, and you divide it by your total daily dose. That's it.
So let's go back to our example person, right? Their TDD was 60 units. So we do the math, 100 divided by 60, that gives us 1.7. But what on earth does 1.7 even mean? It means that for them, 1 unit of their rapid-acting insulin is expected to lower their blood sugar by about 1.7 millimoles per liter.
And this chart right here, this shows exactly why this is so personal. Look at the person on the left. They're more sensitive to insulin, so they use less of it overall. That means each unit has a much bigger impact, giving them a higher ISF of 4.0. Now look at the person on the right. They're more insulin resistant, they need more insulin daily, so each unit does a little bit less work, giving them a lower ISF of 1.2. See, it's completely unique to you. Okay, so we've got our number. Now for the really cool part. How do we actually use it? This is where the theory turns into a seriously powerful tool for managing your blood sugar day to day. So the correction formula starts with some pretty simple subtraction. First, you just figure out the difference between where your blood sugar is right now and where you want it to be. All right, once you've got that difference, you take that number and you divide it by your personal ISF. You know, that special correction power number we just figured out? And voila! The number you're left with is your correction dose. It's the precise amount of insulin you need to bring that high blood sugar right back down to your target. Pretty neat, right? Let's make this real. Using our example patient again, let's say their blood sugar is 15 and their target is 7. Okay, so first, 15 minus 7 is 8. That's the difference we need to correct. Now we take that 8 and we divide it by their personal ISF of 1.7. That gives us 4.7 units. In the real world, you'd probably round that up to an even 5 units for your correction dose. Okay, but, and this is a huge but, maybe the most important part of this whole explainer, that number we calculated, it's just a starting point. It's a fantastic estimate, but it is not the final answer. Now we need to talk about fine-tuning. You really have to think of the 100 rule as an educated guess. A really, really good one, but still a guess.
Your true, actual ISF has to be discovered by testing it out and seeing how your own body really responds to insulin. And why is that? Well, because you're a human, not a robot. Your body is always changing. Your insulin sensitivity can be different in the morning versus the evening. It can change after you exercise, when you're sick or stressed. There are so many things that affect it. Your ISF isn't just one static number, it's dynamic. And knowing that is the key to going from good control to great control.
So you're probably asking, okay, how do I find my true ISF? Well, you test it. There's a gold standard method for this, and it's something you should always do with your healthcare team. It starts with making sure your background insulin is already dialed in. Then, when you're fasting and your sugar is stable, you take a tiny correction dose, say 1 unit. You wait a few hours, don't eat anything, and then check again. That total drop you see, that's your true ISF for that specific time of day. So here's the big takeaway. Think of it like this. The formulas are like the first chapter of your story, but the rest of the book, that's written by your own glucose data every single day. By learning to calculate, test, and fine-tune your ISF, you're not just crunching numbers, you're learning to listen to the unique story your body is telling you. So the real question is, are you listening? Thanks for tuning in.